Hello, everyone. I'm Kate Galvin, Health Executive at NAB. So firstly, I'd like to acknowledge the traditional owners of the land on which all of us are separately sitting this evening and pay my respects to their elders past, present and emerging. Now, the acknowledgement is a great reminder of connection and place, of slowing down to acknowledge where you are. It's also important, I think, to acknowledge that the majority of us on this call this evening are in lockdown. Now, as a proud Melburnian, I've spent a lot of time in lockdown over the last 18 months. As I say to my bankers, I encourage everyone who finds themselves in lockdown to look after themselves, try to be calm in the face of uncertainty and to have hope for the future. And hopefully we'll provide some this evening. At NAB Health, our thoughts are often on the importance of the work that our health sector customers are doing during this extremely challenging second year of the pandemic. We know anxiety around health is high. Business has been interrupted like never before, and working conditions for you and your staff are incredibly complex. Please remember that your bankers and I are here for you to help as much as we can. So what does health executive at NAB mean? I've got the privilege of working across hundreds of experienced health bankers to make sure that NAB supports the health sector in a considered and useful way. Nearly $20 billion of NAB's balance sheet is committed to the health sector. We support hospitals, aged care, practices, all kinds of practitioners, dentists, vets, and most importantly for this call, we support pharmacists. Through MedFin for over 30 years, we've used our deep understanding of health practices and practitioners to provide specialised financing. Via high caps, we've supported health payments and our health insurers in excess of over 20 years. As an organisation, we are committed to serving the pivotal sector of this pivotal sector of the Australian economy as it fights the pandemic and to help our communities continue to prosper. As many of you know, we've demonstrated our support with speedy COVID packages. More specifically in our health businesses, we've accelerated our ability to support our customers with online pharmacy. We've quickly adjusted to telehealth payments, and we've advocated on behalf of the aged care sector both during and after the aged care Royal Commission. I think the good news for us is that we've grown banker numbers over the last year in regional Australia and in our metro areas. We've invested in training and in pivotal systems like high caps. The team and I are grateful for the purposeful work we're able to do in supporting NAB Health, MedFin and high caps customers. And I'm really pleased to welcome you all to this conversation tonight. So as a nation, we've spent the last 18 months in a conversation about the balance between economic and health outcomes. We know people will make economies, and we know we need healthy people to have a healthy economy. Health bankers have always been cognizant of how the work we do helps our clients create a healthy Australia. There have been many negative impacts from the pandemic, and my guests and I are about to discuss quite a few of these. But one of the positive aspects has been that all Australians now understand the importance of a healthy and well-functioning health sector. Thank you from all of us at NAB to all of you, your leadership, your fortitude, your courage and professionalism that you've shown over this really challenging time. So when I started organising this event 4 or 5 months ago, it looked like Dean and Alan and I might be lucky enough to get on the plane and fly around to the capital cities like we used to do. Sadly, this is still really impossible for us, so we worked really hard tonight to try and put together an informative and helpful event. I think the one advantage of being able to do an event like this virtually is we're able to have many more people join. So if you haven't dealt with NAB before, if you'd like to go into the chat box, you'll be able to find in there a link to fill out a form, and we'd love to give you a call back and talk about how we can help you. Now, a great session, I always say, is an interactive session, whether it's live or whether it's virtual. So I would encourage all of you at any time if you have a question to please go to the question and answer button at the bottom of your screen and enter your questions there, and we will make sure that we have time to address the questions at least at the end, if not as they come through. So hopefully, as you can see, I'm joined by 3 panelists for our discussion this evening. Each of them will speak for a little over 10 minutes, leaving us plenty of time for questions at the end. So please join me in welcoming Alan Oster, NAB's Group Chief Economist, Dean Pearson, our Head of Behavioural Economics, and Trent Toomey, the National President of the Pharmacy Guild of Australia. Welcome, gentlemen. It's lovely to see you, even if it's virtual.
Thanks.
So, Alan, you had 15 years at the Federal Treasury and nearly 30 years at NAB, just a few more years than I've had, being responsible for our economic forecasts. And we were just discussing before we started this call, I don't think we ever would have thought that a year ago we would be sitting here bizarrely in similar but also very different circumstances. Because we saw Australia actually leading the world out of the pandemic recession. And now we've got over half the country in lockdowns. So tell us how you think that these current lockdowns are going to derail the recovery we've had next year.
Well, I think one of the lessons out of the last 12 to 18 months is when the economy gets locked down, it really hurts. I'm going to put up a slide here, but I'll make a few comments before and just then talk you through some of them, some of the interests. Number one thing is that when the economy does get locked down, it hurts a lot, much more than what you would traditionally expect. The other big thing that surprised everybody is once you unlock it, snapback is really strong. Now, basically, as a result of the current lockdown we're in, we were previously, before that, expecting growth in the September quarter to be something like 1%. Now we're expecting -2%. So that's a really big slowdown. If you assume, and we were sort of half hoping that we would have some easing in the lockdowns by October, not out of it in Sydney, then maybe you get a +2 in December quarter. From a big picture, say, well, if you forgot about the lockdowns, by the end of 2022, you'd be sort of back to where you were. So we're sort of saying that we might see growth of 2.5% this year. Unemployment in the short term, I think, will go up to something a little bit above 5%. But even if we're wrong and that the lockdown continues and the December quarter doesn't kick back as much, I think you just get a bigger kickback in the March quarter. So the next year, we're talking around 4.5% of growth during the course of the year, which is quite strong, not quite as strong as the Reserve Bank, pretty strong. And therefore unemployment around 4.5%. And by the following year, we're more like trend and something like unemployment around 4%. And that levels of unemployment is probably enough to start to get some wage increases going. And therefore you start to see the Reserve Bank increasing rates. So for me, when I look at the economy, I've been surprised, like everybody has been, how resilient we've been, how we've snapped back. But I'll show you some data later, which sort of says, just at present, that September quarter -2 might be -3. And so we're sort of worried about that. We don't really see wage prices increasing much. And so overall, fiscal policy is the thing that matters rather than monetary policy. And whilst they're spending everything they've got at this stage, they're not counting a new election yet. So I expect to see more fiscal policy. So I think very stimulatory. RBA is probably not going to increase rates until 2024, because when you're thinking about what's happening, ultimately you've got to say, when will wages be growing faster than 3%? And that's a long way out. So we just move to the next slide. This sort of just shows you sort of forecast what we're talking about. So red bars there are essentially quarterly numbers, and through the year numbers are basically in the black lines. So again, you sort of see this really big kick up that's in sort of slowed because of September, December, but then kicks up again. So overall, I think it's still optimistic, and we have done much better than the rest of the world. But reality is that's the sort of pattern we're looking at.
So, Alan, you've talked about fiscal and monetary policy. We've seen amazing things happening in our property market with the incredibly low interest rates that we've had over the last little while. How are you thinking that's going to continue?
Well, on the property market, I think and there's a slide there that we can put up, but I can talk to it anyway. So we have house prices around 21% up this year in just about every capital city. But eventually, affordability hurts. And I think the banks are generally thinking about, well, they're starting to increase fixed term interest rates, and they're looking about the buffers that they need. So affordability will hurt. What we sort of got wrong last year was we were really scared because we thought unemployment was going to be 12. We thought rents were going to go through the floor, etc., and population was going to be really low. That was all true, but what we didn't realise was that people would be happy to work and buy where they live. And so one of the things that people don't realise is outside the capital cities, the actual house price increases as fast as the inside the capital cities. And the other thing that's been really important as we go forward on these sort of numbers is that it's actually cheaper now in a lot of cases to buy a house, get a mortgage, than it is to rent. And so the big driver have been first home owners, owner occupiers, not a lot in investors. So the Reserve Bank is worried about things like, are we easing back on our credit restrictions? But they're not sort of seeing it yet, and the reality is we're not.
It makes sense when you put it so sensibly. It makes sense, and I'm sure it sits with what all of us are experiencing in our broader circles in the community. So there's a number of COVID risks that could materially shift the economic outcomes, as you talk about them, both in the short term and the long term. What do you think are the biggest risks, and what are you most concerned about when it comes to how the pandemic's unfolding?
Well, the risks obviously have to be the virus, because underneath it, you are going to get recovery once you get your vaccines, and once you also start to see a reopening of the economy. That doesn't mean some sectors won't be in deep trouble for a really long time. And so, if you've got a pharmacy, you might be fine if you're out where people live. But if you're in the CBD, you've got a problem. And everything in the CBD, we put out a business survey today on CBD property, and that was even before they knew about what was happening now in terms of lockdowns. And basically, vacancy rates in big capital cities, 10% plus. Anything that's doing well is industrial, where you need online. You need sheds for online. So I think the risks tend to be that maybe the virus will mutate again, and that it will disrupt going forward. But if I can sort of say an optimistic thing, I think Australia has handled the virus better than just about everybody else, and we do not have the scarring that other economies have. So I'll use the example. So in Australia, we've already got back and we're above the level of employment we were before it all started. In America, they lost 20 million jobs. They've still lost 5 million jobs. So that's not Australia. So I think the risks tend to be short-term and issues associated with the virus. Obviously, there's always the unexpected thing you don't know, like a war or whatever. But I think short-term downside risk because of the virus, medium-term probably upside risk.
So, Alan, we were talking before, and we often talk about the fact that we oversee over 2.7 million transactions every day. So our data and our insight is incredibly rich. What can you share with us that you're seeing in our recent data?
Okay, so what we do now is, and this is different, we look at weekly data. In other words, every electronic transaction that goes across our system, 5 million a day, we monitor them. And as of today, I can tell you what happened as of Saturday. This is a slide that's a little bit older than that. So that's to the 7th of August. I've got the 14th. And you can't just look at the same week versus the same week last year because of the big problems last year. So what we tend to do is we look at where are we now compared to the beginning of the year, and where were we in the dotted lines, where were we in 2019? And what you can see, black is essentially consumption, red is retail, and grey is hospitality. And essentially, where we're at now is that normally hospitality is down around about 10% compared to what it was at the beginning of the year. Normally it's 20% up. And so hospitality in particular, well, actually, if I use today's numbers that you haven't seen, they're down 30%. And so you're getting really big hits in terms of what's happened to activity. And we can see it live. And so this is the sort of thing we look at and the sort of thing we give to the government, the ABS, etc. So that's actually quite a scary chart. If you look at the next chart, this is a bit of spaghetti, but basically it shows you where the various states are. Red there is New South Wales and blue is Victoria. If I updated the data, New South Wales is now below everybody else. ACT is also in trouble. And Victoria is just about as bad, because I think the Victorian lockdown tends to be more aggressive than what the New South Wales ones have been in the past. ACT is also having trouble. Who's doing the best? Country or states like Western Australia and Tassie that have got borders that are long way. So again, you're seeing quite big impacts by region and also essentially across what we're seeing overall. And whilst that transaction data is now starting to show up in the profit numbers as well. So that's also a bit of a concern.
I suppose you can see from this, Alan, can't you? And I hope my sound's okay. Trent, give me a thumbs up if it's slightly better. Thank you. You can see how it bounces though when lockdowns.
Oh, yeah, and there's weekly patterns in these things, which is really difficult because you might be able to seasonally adjust monthly, but weekly seasonal adjustment is a very black art. And so we tend to just try and look at it from there.
And just on data, Alan, we know that we're really lucky because we've got another source of data in HiCaps.
Yeah.
And with a third of all health spending coming from non-government private consumption, you know, this data is, the data we have through HiCaps is actually a pretty good proxy for overall health spend.
Yeah.
Can you tell us what we're seeing from the HiCaps data?
Okay, so this is the HiCaps data, and we try and then map it up against what happened against health spending in the national accounts. And what you can see is pretty much disastrous last year, massive recovery. Now, these numbers are basically a little bit up and down because you are comparing this year to last year. But if you look at the latest numbers, which is July, it's gone negative again. So you're seeing, again, the lockdown impact of what we see in terms of health and health spending. There's another chart there where we tried to, not so much from HiCaps, we look at our own transactions data. And so if we move that chart now, it's showing spending by chemists, basically, or in chemistry. And so if you look at the sort of numbers, green is where we were in June, and then July, and green is good. Okay, it's growing. Then we come to July and you see the red. And you see the red basically just about everywhere, particularly in Victoria and South Australia. And then we can do it by postcode. And again, you see some bounces, but you see little spots of green somewhere and mainly not so much green. And I'd make one other point, and that would be, if I could do it CBD versus non-CBD, the CBDs would all be very red. So what we're seeing is health following the rest of the economy, but it was really good and the comeback was really strong up until July or up until June, and then it sort of basically fell over. And I suspect that's going to continue because it's following consumers' trends. They'll need to get their medicines, etc., but they won't need to go and buy a new toothbrush. So that's basically what we're seeing.
No, and Trent, you and I were discussing that earlier in the week. The challenges faced by pharmacies sitting in CBDs are really massive at the moment.
It's a story of two halves, isn't it, at the moment? CBDs versus regional, rural, and remote pharmacies, just telling two completely different stories.
Yeah.
Well, Alan, thank you for that very concise and well-timed within the time frame deep dive. We've got some good questions in the chat. I saw them come through, so we'll hold them over for our Q&A session. Dean, we might have a chat now about the work that you've been doing. So we know across the world, pharmacists have been standing up to the challenge of COVID-19, and they've been committed to the communities that they serve. So as the pandemic tested health systems all around the world, pharmacy professionals showed themselves to be an integral part of that system. Pharmacists have played a crucial frontline role in the management of the pandemic, supporting government initiatives and ensuring patients receive the medicines that they need. The demands on community pharmacy and staff, and I'm sure you'll talk about this as well, Trent, have been immense. Community pharmacy didn't close, they couldn't close. They are and have always been essential. And I think the last 18 months have really highlighted that. So this year, Dean and I took it upon ourselves, didn't we, Dean, to survey 1,000 Australian consumers exploring their attitudes to pharmacy, including issues such as trust, the most important factors when choosing a pharmacy, satisfaction with quality of care and service, what additional services consumers would value from a pharmacy, and what they'd be willing to pay for those additional services. So we're going to break down between Dean and I the key findings. So Dean, let's start. How are pharmacists viewed by Australians?
Well, there's certainly a lot of positives in all of this, Kate. I mean, it's no surprise, I'm sure, to this audience, but pharmacists rank in the top 3 most trusted professions in Australia. We had 1 in 3 Australians identifying their pharmacist as their most important health provider. We had pharmacists among also the most accessible health professionals in the community. On average, Australians visited a pharmacist about 18 times a year, and that rose significantly for the over 65 cohort. Not surprisingly, the main reason for visitation was to have a prescription filled, but there were lots of other important reasons, and those included things like buying vitamins or supplements, over-the-counter medications for pain relief, to purchase cosmetics and toiletries and medications for colds and flu and for allergies. Now, we also, as you mentioned, we wanted to know, well, when you choose a pharmacist, what are the key drivers in that choice? And there were 2 key things. One was convenience and location. The other one was cost. But there were other factors there, as you can see, things like a friendly and personalised service, expertise, and once again, that trust features prominently there. And I would think that these drivers have become even more important post-COVID, because what we can see in our broader consumer research is that consumer values have fundamentally shifted. And we knew that even prior to COVID, that consumers were becoming much more considered in their purchasing decisions. They were directly trying to support local businesses. And we know that these commitments have intensified much further since COVID. So COVID's really encouraged consumers to seek care closer to home. And as Alan mentioned, this 5K, 10K radius, that's meant that they've potentially built a network of really allied health professionals, including pharmacists, that support potentially their longer term health needs. And while we know that community pharmacists have always gone certainly well above and beyond to provide a uniquely personal local experience for their patients, this has probably been even more apparent during COVID, and potentially that's going to reinforce, we think, patient loyalty going forward. Now, that loyalty factor is really important, Kate, because 1 in 5 consumers told us they had switched from their regular pharmacy because they were either unhappy with a service offering or a product offering in some way. People who required ongoing treatment or medication for a medical condition were much more likely to have indicated that they potentially had switched their main pharmacy than those who did not require ongoing treatment. And again, it was cost that was the primary driver, but there were a number of other reasons, things like having to wait for prescriptions, the pharmacy being out of a specific item or medication, the pharmacist not being, in their view, proactive enough in offering cheaper medications and not being able to consult the pharmacist or needing more individualised service.
Thanks, Dane. So you touched on the fact that you looked into customer loyalty.
Yeah.
What did we learn about customer loyalty when it comes to their pharmacists?
We learned a lot. We learned a lot about satisfaction too of pharmacists. We also learned that, about 7 in 10 Australians say that they principally use one pharmacist, one pharmacy for their prescription needs. That was over 9 in 10 for the over 65s. About 6 in 10 said they used the one main pharmacist for the OTC medicines they required. And for other products and services, it was still around half of consumers. And this is the representative panel of Australians, so it is a representative sample. Over half still said they just use one main pharmacy. In terms of the type of pharmacy visited, for prescription medications, around 1 in 2 Australians use a discount pharmacist, 4 in 10 use a traditional pharmacy. Only 3% had said they'd visited a pure online-only pharmacist in the last 12 months. Now, for other products and services, 6 in 10 Australians had visited a discount, 1 in 4 a traditional, and again, only 4% an online-only. You can see by demographics, and we've got a report that people can see later, but the over 55 showed much stronger loyalty to one specific pharmacy. The older people get, the more that loyalty was very prominent. In general, the satisfaction with their pharmacist and their pharmacy was really very high, both for traditional and discount, with traditional pharmacy coming out slightly ahead. We know that traditional pharmacies really led the way for satisfaction, really encouragingly around quality of care and the services provided. Not surprisingly, the discounters, as you can see there, were ahead slightly for value and cost, but traditional pharmacies were viewed not that significantly behind there. Around 1 in 10 Australians had chosen not to have a prescription filled, however, because of cost. That rose to about 1 in 5 amongst lower income groups. About 1 in 5 people had used an electronic prescription in the last 12 months. But again, it was much more common for younger Australians rather than older Australians. And I think what the research really shows is that Australians are really very satisfied with electronic prescriptions, particularly higher income earners. There was a differentiation between wealth here, and the satisfaction was again lowest amongst the, not surprisingly, the older population.
So Dane, throughout the pandemic, around the world, there's been growing recognition of the role of pharmacy in public health. So the management of health conditions and common ailments, this creation of local health hubs and triage points, it's the pharmacy is really an essential pillar of the collaborative and frontline primary healthcare workforce. There's also this recognition of the untapped potential in pharmacy for the community. So what did the survey kind of tell us around consumer support for the expansion and scope of practice for our pharmacists?
Yeah, absolutely, Kate. That came through really strongly, and you can see in the results there's some really clear opportunities here. More generally, what we're seeing is patients are becoming more empowered and they're having more agency over their own health. And we're releasing another report tomorrow, which is more of a generalised view of how Australians see their own health, their health behaviours and their attitudes to telehealth and telemedicine. But within that report, it shows about 4 in 10 Australians believe they are now prioritising their health more since COVID. More generally, it does show a degree of increased health consciousness amongst Australian consumers. That's also led to this, the growth in the so-called wellness industry. Consumers are becoming certainly a lot more aware of a broader range of physical and mental health products and services. And we've seen particular growth in things like anti-aging, hygiene products, air purification systems, UV treatments, antiviral sanitizers, memory brain enhancers. I could do with a bit of that, having had lockdown for 18 months, sleep aids, natural clean beauty supplements, meditation, mindfulness apps, all of these things. But at the same time, and I think this is really where the interesting opportunity starts to emerge, more wellness products are now being promoted on the basis of their so-called scientific credentials. People are becoming a lot more concerned with their immunity, of course, because of COVID, and they're much more conscious of the health sciences. I don't think too many Australians knew what an epidemiologist did probably 2 years ago. We certainly all do now. There's also been more interest amongst consumers of having more qualified practitioners rather than towards more credible views of wellness. Now, it remains really to be seen whether there will be this improvement in health literacy going forward. But what's really clear, I think, from all this research is that pharmacists can play a particularly important role here, ensuring patients really understand the efficacy of some of these wellness products and practices. But either way, the rise of demand for natural and alternative approaches to healthcare is certainly here to stay. We've also seen across all of our consumer research, really strong growth in people wanting to buy Australian-made products. Now, I don't know if that's going to translate into medicines per se, but what we have seen across the world is when some medicines became unavailable during COVID, in many parts of the world, compounding pharmacies had to really step in and help here. So perhaps there is scope here to raise the prominence again of compounding pharmacies post-COVID. But some of the less positive news here is while COVID's motivated a lot of consumers to be more proactive in caring for their health, I would still argue that the funding model for the health system is really very much focused on treating illness. I read a really terrific quote in the Medical Futurist magazine, which I think sums up the opportunity particularly better than I could. And they wrote that as patients are the most underused resources of healthcare, pharmacists are the most underused resources of medicine. So pharmacists already, of course, devote a huge amount of their time to their patients, but there are some really clear areas here where consumer demand is growing. Now, the big one, of course, is we're all desperate to go on a holiday and when the borders finally do open. And as those border restrictions are slowly eased and Australians really start to travel again, travel health will, of course, be really, really important. About 1 in 4 Australians told us they would prefer to see and receive their travel health vaccination, their travel medicine, and all advice in regards to that from a pharmacist ahead of a GP, a pathology centre, or any other specialist. 4 Australians said they would prefer to receive their flu vaccine from a pharmacist. 1 in 5 Australians said they would prefer, and I did last night, I got my second COVID vaccine from my local pharmacist, would prefer to receive it from a pharmacist. And I think the survey also really reinforces the opportunity for community pharmacists, as you mentioned before, to become a real health hub for health promotion and preventative measures. While pharmacists really already conduct preventative health programs, there is clearly scope to expand this further. 1 in 5 Australians said they would preference their pharmacist and their pharmacy over any other health provider for health programs, including things like smoking and nutrition and asthma management. Now, the other ability that really comes through, I think, here is the ability of pharmacists to provide that point of care testing, diagnostic testing within the scope of the practice. That's a key asset really here because 1 in 5 Australians saying they would preference their pharmacist for health screening tests. And that's pretty significant, I think, at the moment, Kate, because while we mentioned before, COVID has motivated a number of Australians to clearly be more proactive in their health. But for many Australians, completely the opposite has occurred. 1 in 3 Australians told us they don't have regular health checkups. Now, COVID, of course, has led to a decrease in preventative health screenings, with some patients have been more hesitant to see their healthcare provider. Now, of course, the resulting cost implications for the health system could be really substantial here. Another important issue is, of course, the management of ongoing common health conditions. 1 in 5 Australians said they would primarily seek advice and treatment for minor injuries, health conditions from their pharmacist. 6 in 10 were supportive of pharmacists managing common health complaints such as back pain and eczema and so forth. A similar share believe their pharmacists should be able to diagnose and prescribe for minor ailments and conditions.
All right, Dean. So I'm looking forward to your views on this because I imagine that lots of Dean's data is going to back up what you're going to talk about. I think, Dean, it's really important for us to just say that our survey shows that community pharmacies are in a unique position to respond quickly and effectively to solve the needs of their local populations. They're trusted, they're highly accessible, they've got agile, knowledgeable teams who are well trained and attuned to the needs of their community and we really want to help them. And I think you're right in calling out that they're really underutilised. So thank you so much for sharing these insights with us. We've got some good questions coming through that we can get to with the panel after we've heard from Trent. So Trent, I'm sure that we are not telling you anything you don't already know or haven't heard before, but I think it's really great to be able to back it up with some really current data. You've been involved in the Pharmacy Guild for over 10 years. You played a pivotal role in negotiating the 6th and 7th community pharmacy agreements, and congratulations again in person on your recent elevation.
Thank you.
President of the Pharmacy Guild. I'd really love to hear your thoughts on pharmacy and where the sector finds itself at the moment.
Sure. So we've put together a couple of slides for you, and thanks again for having me. And many of the pharmacists online mightn't know, but Georgina and I bank with NAB, and we wouldn't be able to do what we do or have been able to build what we have built without the support and partnership that NAB has given us. And I just wanted to say thank you for that, Kate. It doesn't go unnoticed, and we find you a very valuable partner in our businesses. But just to build on everything Alan and Dean has said, and this is not death by PowerPoint, I only have 4 slides. But this particular slide here dovetails nicely into all of the consumer sentiment that Dean presented. The reason I'm such a strong advocate for full scope of practice is twofold. One, I need to be able to retain and attract the very best talent to my profession. And we are being faced with many headwinds, digital disruption, closed hard international borders that is making it difficult for us to trade in areas that traditionally have been quite easy, being able to employ and get staff. But to be able to attract and retain talent, we need to be able to ensure that the pharmacy profession evolves and we can utilise all of the skills and knowledge that our new graduates have. What we are seeing in trends in employment data is we see pharmacists exit the pharmacy profession after their first decade. We see a big exodus of pharmacists in their early 30s. And that's for a variety of reasons. Least of which is they can't see a career path other than becoming a community pharmacy owner. And many young people simply don't want to be a community pharmacy owner, as Georgina and I have in the past. So the first reason I'm such a strong advocate of full scope of practice is to be able to attract and retain the very best talent. And to do this, we need to be able to do 4 things that we currently are not doing to the fullest of our potential. That is to be able to prescribe all medicines for all patients, dispense all medicines for all patients, administer all medicines to all patients, and review all medicines for all patients. So prescribe, dispense, administer, and review. Dispensing is easy. We can do that for all medicines for all patients. We can review all medicines for all patients. But the real big change in the tasks that we will be able to perform at the end of this full scope of practice journey will be in the prescribing and in the administering. And we're seeing that now in the vaccination space. So the things that we will be able to do once we can perform these 4 tasks means that we will be able to treat vaccine preventable diseases and prevent vaccine preventable diseases. We will be able to treat acute occasions of service, and we'll be able to manage chronic disease. So if we can prescribe, dispense, administer, and review all medicines for all patients, we will be able to not just do influenza vaccines and COVID-19 vaccines. We will be able to do, as Dean quite rightly pointed out, not just travel medicines, but all of those vaccine preventable diseases that people are currently obtaining from either state or territory health facilities, community controlled health organisations, or indeed their local general practitioner. Acute occasions of service, a specific example of this, and there are 2 very real ones when we look at the Australian Institute of Health and Welfare's data that lists the top 10 potentially preventable hospital presentations. And there is a little bit of difference between one state and the next, and indeed in Queensland between potentially preventable hospital presentations in Brisbane versus the ones that I personally experience up here in far north Queensland. But by and large, the top 10 just change their order as we go from one hospital and health service or one district health board or one local health area, depending on what they're called. And 2 of the top 10, I've run out of my prescription. So a top 10 potentially preventable hospital presentation in every hospital, in every state and territory in Australia can be solved by continued dispensing. And we have seen massive gains in the continued dispensing space as a result of the bushfires in early 2020. And then, of course, that was rolled out to all state and territories, and it indeed still is available for all medicines other than those very expensive ones and, of course, controlled drugs. The second one is uncomplicated urinary tract infections. And there is a trial happening in in Queensland, I should say, at the moment. There have been 5,000 occasions of service in the last 18 months, 5,000, of which women paid with pleasure to be able to avoid going to a general practitioner or avoid presenting to an emergency department. There are, of course, the other 8 that we will continue to tackle. The chronic disease space, of course, are those big diseases. So we're talking mental health, we're talking cardiovascular and renal disease, we're talking chronic obstructive pulmonary disease. It's being able to not just diagnose, but being able to prescribe and manage these chronic diseases. And these things, as Alan alluded to, are what pharmacists are playing an ever larger role in other highly developed countries, namely Canada and, of course, the United Kingdom. The big thing that COVID-19 has brought for us is we're not kicking down the door asking for these things. We're now seeing state and territory governments knocking on our door, asking how we can help. COVID-19 vaccination is a very good example of how we've been able to utilise the current pandemic to be able to increase the breadth and scope of things that we can do to prescribe, dispense, administer and review in the vaccine preventable disease space. So this is some data as of the 16th of August, and we hit, as those of you that read trade journals, we hit yesterday the 100,000 mark. Now, general practice gave 1 million COVID-19 vaccines last week alone, and we've administered 100,000 year to date. Given we only had 49 starting in May, general practice has had thousands participating since March. But what we will see as a result of community pharmacy playing a role in COVID-19 administration is an acknowledgement by state and territories that, well, if pharmacists can administer COVID-19 vaccines, why can't they administer the full gamut of vaccines as they exist on the National Immunisation Program? So we will see, I believe, and the first pharmacist administered vaccination was in the state of Queensland. It was in 2014 and it was for influenza. But what we will see by 2024, I have no doubt, is a narrowing, if not a complete alignment of the scope of practice for a general practitioner, a nurse, a registered nurse, and a community pharmacist for the administering of all vaccines on the NIP. So the Australian Immunisation Register. The reason I've got this one on is because I do want to talk about digital enablement and digital disruption. And just as Dean and Alan alluded to, consumer sentiment is changing, and the government is looking even more at real-time data. Now, whether that's data that comes from the big 4 banks or whether that's data that comes from the Australian Digital Health Agency. And if you didn't record it, it didn't happen. One thing that community pharmacy is very good at is embracing technology. We were very good at digitising the way we dispense a prescription. We were very good at digitising the way that we administer vaccines. So I'm very proud of the way the community pharmacy sector has not only embraced vaccination as a service, but ensured that each and every time a clinical occasion of service involving vaccinations is performed, it is recorded in live time on the Australian Digital Health Agency through the Australian Immunisation Register. But we need to make sure that we are digitally enabled in all of these areas. So the last slide that I have, I believe, is an NAB bank slide. Yes. And I just want to give a shout out, and this is an unashamed shout out to the efforts of Kate herself. But my pharmacy now.
Let's just be clear, Trent. I didn't ask you to do this.
No, you didn't. No, you didn't. This is not fair. I'm not getting a kickback or anything like this. But CommBank, because we're able to get NAB first across the line, CommBank has fallen, and we received a correspondence by my chief economist from ANZ only last week that they're coming on board at the end of this month. So I've just got to work on Westpac, and then I've got the big 4 banks, and then I'll worry about the tail later on. Their community pharmacy. So Dean, you said that pharmacists, patients rather on average, visit their pharmacy 18 times a year. And by and large, the majority of those are physical visits to a bricks and mortar network. Now, I'm the president of the Pharmacy Guild of Australia. I will continue to advocate for the preservation of the bricks and mortar network. But what we need to acknowledge is that there is a percentage of those 18 visits a year that consumers want to be able to choose you. They want to be able to remain loyal to their local community pharmacist, but they want to be able to access you through this or through their desktop or any other number of ways that they want to be able to interact with you. And that's not just to book a vaccination, that's to order a prescription, that's to buy baby products, or that is to purchase scheduled medicines. And NAB Bank was the first bank to enable the sale of scheduled medicines online whilst utilising their own merchant bank facilities. So that was I spoke last year about friction cost and automation isn't just getting a robot, it's digitising the friction cost between one system and another. And we have made very big gains as a community pharmacy sector in the last 12 months about being able to do this. So consumers do not differentiate between accessing a product or a service from a community pharmacy. Dean's research shows that. And they want to be able to get it from us. It's just not every time do they want to have to physically visit your pharmacy to be able to do it. So it's incumbent upon all of us to ensure that we respond to changing consumer expectations. And that they are able to remain loyal to me as their local community pharmacist when they want and how they want. So that's my final slide. Thanks, Kate.
Fantastic. Thank you, Trent. So as I said at the beginning, an interactive session is a good and lively session. So we're just going to play a quick 1 minute and 30 seconds of videos while everyone has a think about their questions. We've actually had some good ones coming through and I've got some up my sleeve, but we cue to the video while we do some thinking time.
I'm Dr. Cindy Nguyen and this is my husband, Dr. Luan No. We are business owners of Perio Partners.
As dentists, we're not trained in running businesses. We're trained to deal with teeth. It's a big step up to try to figure out exactly what we need to borrow. Having NAB Health, Medfin and HiCaps together makes running the business so much easier, and it gives me a better snapshot as to how the business is going.
NAB, more than money. Ideas are really important to our business. So we have quite a richly collaborative team where everyone consults about new ideas, new approaches to healthcare, new approaches to customer service. We've connected with our bank manager so often that now he's almost part of the family, where we can really just pick up the phone and say, hey, I need to chat to you about an idea, or I just need to chat. NAB, more than money.
I think for every business owner, ideas and innovation should be at the heart of everything they do. By differentiating ourselves from everyone else, we're able to build a better patient experience, we're able to build a better staff culture, we're able to grow a larger business and provide, excellent and world-class oral health care. The best way to describe my relationship with NAB Health and Medfin is that they're there when I need them. Every time that we've looked to grow, they've been there.
NAB, more than money.
Thank you. Thank you for your questions as well. So I think we might start with you, Trent, and hopefully you can hear me because I'm getting multiple messages on multiple areas about how I'm hard to hear. Dean, give me a thumbs up if I'm basically screaming into the computer now. So my apologies, everyone, if my sound hasn't been perfect. It's the essence of Zooming, isn't it? My first question is for you, Trent. We've heard Alan talk about wages pressure. Yep. How are you and the Guild finding or feeling about wages pressure?
We have a big problem at the moment. We have a hard international border and a big source of talent for our profession, and I'm talking both pharmacists and pharmacy assistants, is skilled overseas migration. And we have not only had that source completely dry up, but so has every other sector of the economy. So I met with the 2 employee unions last week to talk about this very specific issue. I don't think the Pharmacy Industry Award 2020, which is now in its 11th year, because it was, of course, the PIA 2010 before that, is fit for purpose for attracting and retaining talent. And I want to have a look at it. I don't want to be the president of an industrial union that responds to the questions of work value that are put before me, or and waits for there to not be work pressures but a workforce crisis. I want to have a conversation about how I can have a more modern and contemporary industrial relations framework that enables us to do that. But of course, that is just one aspect that will enable us to attract and retain talent. Having full scope of practice, which enables a more clinically, professionally rewarding career, is the other half of that story. And when you win the wooden spoon in the OECD for the scope of practice of our profession, we are dead set 35 out of the 35 countries in the OECD in terms of what a pharmacist can do, the services we can provide. This is something that we have to fix. And I know we can do it because when we talk about the public and we don't talk about ourselves, and we talk about the things we can do to improve healthcare, the things we can provide consumers, the benefit that will bring to central agencies at state and territory levels and at Commonwealth level, the savings that will bring to our health system, it will happen. And I only need to point to the intergenerational report that was released the week before last. It was delayed from last year. It's been released every 5 years since Costello was Treasurer. It showed an absolute out of control growth for public hospitals and for the MBS, and it showed a dead set flatline growth for the PBS for the next quarter of a century. So from a business point of view, not just an attracting talent point of view and a public health point of view, the business reason I'm such a strong advocate for full scope of practice is because the provision of vaccines is now the largest professional service other than dispensing in community pharmacy, and it has nothing to do with the community pharmacy agreement or funding from a Commonwealth government. All of those services, and I'm not talking about COVID-19 here now, are paid for with pleasure by the consumer for the benefit, for the purpose of access. And there's a whole raft of other things that we can do. So to answer the question, it's a difficult one to solve, but the Guild's determined to address it.
Alan, have you got any other thoughts on wages and wages growth?
What we normally know is that if you're talking about inflation and keeping it under control, is you can get hit by supply side shortages. You can, so we don't have backpackers anymore. In construction, you don't have those problems. But generally, the number one thing in core inflation going forward is wages. And yes, we've seen some increases in some sectors, but generally, you don't see a core increase in inflation until such time as wages grow significantly. So, as I said, one of the issues for the Reserve Bank is they think they want to have inflation at 2.5. Just at present, wages is growing at 1.7, and they need wages to be growing at +3. And so what they really need is unemployment to come down. And so if unemployment can get down to around 4%, that would be really good in terms of getting some wages growing, which would help, I think, in terms of the general growth in the economy as well.
So we've got a good question here from Rob Brewer for you, Alan, which is, what's the hardest aspect to control to ensure inflation doesn't get out of control? Would you be voting on wages, or is there anything else?
Wages is the number one thing that is basically going to drive us. And I'll put it a different way. I've said to you a number of times in the past, it's all about getting our kids a job. And the lower levels of unemployment we can get, the better. Now, until you get wages, let's say 3.5%, productivity is running 1, you need 3.5% to get 2.5. And so therefore, for me, I think wages is the number one issue. Now, there might be supply side shortages in some places, but not broadly. Broadly, number one thing is wages.
Alan, I've got another question here in the chat which talks about how we had, in the past, up till now, we had support and commercial lease concessions. Without these, and maybe you can talk to the confidence, it's hard right now, but what's your outlook across the medium term for small to medium business?
In medium term, small to medium business, I think the outlook is pretty good, because I think the medium term outlook for the Australian economy is really good, in the sense that, on a health basis, we've done really well. On an economy-wide basis, we didn't have the damage that just about everybody else had. Sure, we have challenges with China, but the main problem there is that they can't come anyway for the universities because they can't get here. I think we can diversify. I think there'll be a lot of people who will look from overseas and say that's a good place to live, to invest, and to employ. Now, there's always going to be certain areas that are going to be more difficult than others. And I think we've all said before, CBDs are not the place to sort of go to for your small business at present. And I think that's permanent change, and certainly it'll be around 3 to 4 years. But generally, I think the outlook for the Australian economy looks pretty good. Everyone says, oh, we've got a huge amount of debt. But compared to everybody else, we've got no debt. So, Australia started at 19% GDP, the world started at 90. And we might end up at 35 or say 40. That's still really low. And if you want a context, US economy by itself in the last 6 months has spent on fiscal policy 3% of global GDP. So that makes us look okay, and we've targeted it pretty well. So I think JobKeeper is one of the great successes of public policy. So I'm pretty optimistic about medium term.
Well, it's good. I think it's good to end on an optimistic note. Now, Trent, I know we've had some questions and some concerns in the chat around scope of practice. Actually, I think we could probably do another hour on scope of practice, but we don't have the time here, and there are understandable concerns from other parts of the sector around limits and expansion of that. But sure. I think that particularly the information that Dean provides, it actually shows there is demand in the community for a greater scope of practice, and how that plays out, I think, will be very interesting as that demand increases. I think a really good virtual session is also a virtual session that ends on time. So at 6:27, unfortunately, we haven't had a chance to get to lots of our questions. I think the most important thing for me to say is all of this content and the research on which it's based will be available at our website after this event. I also think it's really important that you know that we'll have a link to the recordings as well if you want to have a re-listen. And we will look to be doing this kind of in-depth view around subsectors more broadly in the future if you've seen value in it. So please make sure that when you receive the survey in your inbox after this event, you do make time to answer it. The final thing I've got to say for making yourselves available to have this really interesting and informative conversation. And also a thank you to all of our customers that have made time to join us and taken time out of your busy days to hear our views and to have an interesting and hopefully insight. And hopefully this time next year, we look forward to seeing you all in person. So thank you very much for joining everyone. Thank you, Trent. Thank you, Dean. Thank you, Alan.
Bye-bye.